We'll start in 2 or 3 minutes. Okay, I think we'll go ahead and get started. Good afternoon, everyone. My name is Dr. Rob Murphy, and I'm the Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern University Feinberg School of Medicine. Thank you for taking the time to join us this afternoon for our latest installment of the Havey Institute for Global Health First Friday seminar series. Today's the title is From Syria to Ukraine, War is the Enemy of Health. We are thrilled to have Dr. Mohammed Zahir Salul for a discussion of the disastrous effects of war on global health. Dr. Mohammed Salul is a medical doctor, Chicagoan, humanitarian, faith and immigrant, and civic leader and influencer. Professionally, he's a critical care specialist at the Advocate Christ Medical Center and St. Anthony's Hospital, an associate professor in clinical medicine at the University of Illinois in Chicago. He serves as the co-founder and president of MedGlobal. See the slide here, a humanitarian and health non-governmental organization working to serve vulnerable communities around the world by providing innovative, free, and sustainable healthcare. Dr. Salul is considered one of the world's experts on the humanitarian crisis in his homeland of Syria and applying lessons learned to other disaster responses, including COVID-19 and currently what's going on in Ukraine. He led the Syrian American Medical Society from 2011 to 2015 to play a crucial role in providing humanitarian medical aid and organize the Syrian American diaspora. He founded the American Relief Coalition for Syria, ARCS, and the Syria Faith Initiative. He has published extensively on the Syrian crisis, refugees and immigration, disaster management, and COVID-19 impact on disadvantaged communities in Chicago, and was instrumental in providing medical relief to help the civilian populations in his homeland of Syria. He was awarded Chicagoan of the Year, congratulations, in 2016 for risking his life with 2 other American doctors to provide healthcare to the civilians in Aleppo under siege and bombardment at the time. In 2020, Dr. Salul was awarded the Gandhi Award for Peace for his humanitarian work in Syria and at the global level. There'll be time for questions following the presentation, in which we welcome you to submit questions throughout. Please use the Q&A feature instead of the chat function, if you wouldn't mind. Now, Dr. Salul, I turn it over to you for about a 45-minute presentation, then we can take some questions. Thank you very much for joining us today.
Thank you very much, Dr. Murphy. I'm really humbled to be here and speaking to you. Northwestern has a special place in my heart. in 1989, when I first arrived to Chicago from Syria, I spent 1 year doing research in Northwestern. And also I did some courses in non-for-profit management in Kellogg. This is the first place I got to know in Chicago. So
welcome back.
Thank you. I mean, as Dr. Murphy mentioned, the purpose of this presentation is to share with you some of the experiences that I had and my organization also had in addressing the impact of war on health, focusing on Syria because I believe, maybe because I'm Syrian American, that what happened in Syria has been very important and also a little bit ignored by the media and so forth. But also it impacted the way that other wars have been conducted since the Syrian war. So it's important to understand that these wars are similar in terms of the impact on civilians and on health. And how can we learn from the physicians and the nurses and healthcare workers that are going through these rough times? I think we can learn from them more than what we can give to them. And this is basically the gist of this presentation. So that's the title of the presentation: War is the Enemy of Health, from Syria to Ukraine. If you tweet, I think it's good to tweet about what you feel. It's important. This is my Twitter handle. And this is, of course, the website for mediglobal.org. It's a humanitarian organization. We do medical relief and sustainable health programs and building resilient health care systems in 8 different countries in Central America, in MENA region, in Africa, and Southeast Asia, and now in Ukraine. So the impact of war on health, similarities between the different wars and impacts of health, and focusing on Syria and touching on a little bit on other man-made disasters. What can we learn and what can we do to help the population? And I think each one of us can do something. And I hope that this is the main message of the presentation, is what can you do to help? And this is always, I start with this drawing of a second-year elementary school pupil in Aleppo who drew what he saw the impact of the war and the siege of Aleppo on his families and his communities. And as you see, you have helicopters that are throwing barrel bombs. Barrel bombs are barrels stuffed with TNT and shrapnels and used routinely by the Syrian regime on Aleppo and other places, and houses on fire, and children who are dead and mutilated, and children who are alive. And the children who are alive, they are crying, while the children who are dead, they're smiling. So this is a child's drawing. Children do not lie. And this is from our last medical mission to Ukraine in Lviv. And sometimes you go to places and you experience what the civilians experience. And this is one of the instances that we had to go to a bomb shelter because of a siren. I'm going to try to play here the video. So this is the city of Lviv in Western Ukraine, and we had a team of 9 physicians, 7 from the US and 2 from the UK, that went there about 4 weeks ago. We took with us a lot of medical supplies, and this is something that is always heartwarming when you take life-saving medical supplies and it's used right away to save lives. And we provided brief training on chemical weapons based on the request of the local health authorities, and also we brought back stories, we brought back what our guests wanted us to say. And I'm going to share with you some of these stories because they are important. And I'll start with these 2 pictures of 2 young boys. They're same age, actually. This is Mahmoud from Aleppo. He's 12 years old, but he looks like he has stunted growth. He lost his 2 siblings, brother and sister, Ilaf and Abdo, Both of them were the victims of barrel bomb. His mom was in the ICU when I saw him. She was pregnant and she lost her unborn child. Both of them, of course, all the family were victim of barrel bomb, which was the kind of signature of the war in Syria, where the Assad regime used it routinely on civilian areas. And as you see, if you look at his face, he's clearly traumatized. There is no reaction. And this is what you see when you have bombing, when you have wars, when you have siege. Populations are traumatized, especially children, women, and the elderly. And these things stay with them for the rest of their lives. This is Timothy. He's 12 years old. He's from Kiev, or a village near Kiev. He was fleeing with his family from the siege in Kiev, the Russian siege. And then Russian convoy opened the fire on their civilian car, which was marked clearly civilian. He lost his grandma, Nina. She was 61 years old. She bled to death, and both of his aunt and mother were injured, and also his cousin was injured. He speaks perfect English and German and Russian, very brave, and we saw him in the bus being evacuated from Lviv to Poland. Abdullah is 13 years old, a child from Aleppo. I saw him in one of the medical missions to Aleppo. He was a victim of barrel bombing that hit his neighborhood. He had shrapnel in the liver and the chest, and the nurse here is trying to insert a chest tube in his left chest to drain the blood. They had no anesthesia, so he was inserting this chest tube without anesthesia, and the kid was very polite, but crying at the same time and screaming. And many times when you go to war zones, or when you go to areas that were hit with disaster, you have shortage of everything, from medical supplies, from medications, from doctors, from nurses. So people have to deal with very limited resources. And this is something that we can learn in this country. We had our share of limited resources, especially at the beginning of the pandemic of COVID. So these principles on dealing with limited resources and how can you plan and prepare and reallocate and reuse apply in man-made disasters, and also disasters like what hit us 2 years ago with COVID. This is Dr. Mahmoud Al-Hariri. He's a surgeon in Aleppo. Also, his hospital was bombed multiple times, and I was in Aleppo at the time when it was bombed, one of those times, and I rushed to the hospital, and he was trying to salvage some of the medical supplies that you see here, so he can use it for the future, because he was not sure that there will be more supplies coming to Aleppo, which was under siege at that time. This is Talina, 39 years old. She's the auntie of Timothy, the kid that I told you. Also, she had shattered bones in both of her arms, and she was in severe pain when we were transporting her to Poland, and she was asking us to provide her with some pain medications, which also they had shortage of opioid in Ukraine, and also insulin and other medications. And you can look at her face and see how traumatized. I don't have to describe that. All of the civilians who are victims of war are severely traumatized. We'll talk a little bit about the mental health impact of war. This is her dad, who lost his wife, Nina. He was also injured, and he told us in Ukrainian, and we had interpreter, that please let everyone knows my story. So one of the things that we can do as humanitarian, besides if we're not able to do anything else, is to tell the story. That's why it's important when you come back from places of disaster that you mention the stories, you mention the names, you mention the ages, you put the pictures, and let people know that this is happening to individuals like them. Because numbers do not affect the hearts and policy makers, but stories like this may affect them. This, of course, one of the iconic pictures during the peak of the refugee crisis from Syria. This boat in the Mediterranean, which is full of immigrants from Syria and other places. And you're probably familiar with the poetry of Warsan Shire, who said that no one puts their children in a boat unless the water is safer than the land. No one leaves home unless home is the mouth of a shark. So when we hear about the polarization about refugees and migrants and the fact that they are threat and that they are coming here to take our jobs and things like that, you need to understand that these people are fleeing death, and they would rather stay at their homes if they have safety. And it's very important to embrace the refugees who are fleeing their lives, and they expect us to open our hearts and arms to them. Refugees are refugees. I mean, if I'm there, I'm going to ask you which one are the Syrian refugees and which one are the Ukrainian refugees. These are the Ukrainian refugees at the Polish border, and these are the Syrian refugees at the Macedonian border with Greece. To me, they look the same. Both of them have the same blood. Both of them have the same aspirations of fleeing safety. And when you hear the media talking about quote unquote civilized refugees compared to uncivilized refugees, I think we have to call it out and let people understand that refugees are human like us. And there's no difference between Ukrainian refugees, Iraqi refugees, Syrian refugees, Rohingya refugees, or any other nationality. Refugees are us. And these are also some of the pictures from the Syrian refugees in Greece. And these are kids who end up in a refugee camp in Greece waiting to be deployed to Europe. These are pictures of Ukrainian refugees who just crossed the Polish border, and they were received with welcoming a lot of volunteers from all over the world. And we've seen the same thing, by the way, with especially in the beginning of the Syrian refugee crisis in Greece, where you have NGOs and volunteers flooding to Lesbos Island in Greece to help the refugees. And then after a few weeks or a few months, that has changed because of the misinformation campaign, disinformation campaign, and also because some politicians who exploited the situation for their advantage. This is Al-Za'atari camp. At one point, it was the 5th largest city in Jordan. It hosted at one point 175,000 Syrian refugees. Now it hosts about 70,000 Syrian refugees. They're still in this refugee camp 11 years after the beginning of the crisis. Most now refugees stay in refugee camps if they are encamped at least 25 to 30 years. The average lifespan of a war now is about 20-25 years. I always quote this when I talk about Syria, because I think Syria is important. It's located in strategic area in the intersection between Asia and Africa and Europe. This is one of the scholars from Princeton, Philip Pitti, who said that Syria is the largest small country on the map, microscopic in size, but cosmic in its influence, encompassing in its geography. At the confluence of Europe, Asia, and Africa, the history of the civilized world in a miniature form. I think some of you are of Lebanese origin. It's the same thing. Syria, Lebanon, Palestine, of course, Jordan are, we call it in Arabic, Bilad al-Sham, and rich history, of course, a lot of culture, a lot of diversity. Unfortunately, there is a lot of problems related to the political and the economic situation in these countries, including Syria. But what happened in Syria does not stay in Syria, as we have seen. One of the issues that, or the things that I think all of us should be learning, and this is something that we don't learn in medical school, is how to learn from people who are going through disasters, whether it's in Yemen or Syria or other places, where how they deal with limited resources or deal in austere environment, where you don't have abundance of everything. You may not have CT scanner in the whole city, like many cities. I mean, I just came from Gaza Strip in a medical mission, and in the whole Gaza Strip, which has a population of 2.1 million. So for any patient with cancer, how can you manage that without PET scan? There's no radiation therapy in the whole Gaza Strip. There's a few MRIs, but they're very expensive. There's no flow cytometry machine in the whole strip of Gaza. So how to deal with limited resources, how to adapt, how to prepare for disaster, because disaster can hit any place and any time, as we have seen with the COVID pandemic, how to conserve resources, which we're not used to in this country. We throw a lot of things in hospitals that other places may beg for to get what we throw, and that will save a lot of lives in many countries. How to deal with the substitution if you don't have the first or the second or the third line of medications. How do you substitute that? How do you adapt to a long shortage of resources, like the people of Gaza or people of Yemen, where you don't expect things will happen, or humanitarian aid will be flowing quickly. How do you reuse certain things, and how do you reallocate resources? So these principles, which we do not learn in medical schools, are very important in our life and to be prepared for any disaster. These are some pictures from Syria. So this is a vending machine that is used for a blood bank, as a blood bank refrigerator. And this is in the area of Al Ghouta, which was under siege for 5 years. So there is no diesel fuel. So they used animal waste to produce methane gas. And the methane gas was used to produce electricity. So use clean energy because of the necessity. So this is how people adapt to shortage in Syria. Of course, when there is no lights, they used flashlights, and they used also iPhone lights to do operations. These are medical students who had to do operations because there were no surgeon in the towns that they were under siege. So sometimes you have to step up and do things that you're not familiar with. And if you don't have an OR light, you can innovate. So these things, actually, we can learn from people who are going through adversity or disasters. In spite of what I believe, and many believe, that Syrian crisis was one of the worst humanitarian crises in our lifetime, there was not much attention by the US, by our government, to the crisis, and that actually caused huge problems, as we will talk about that. Because in Syria, there were many war crimes. More than 650,000 people were killed, more than 2 million were injured. Number of refugees are biblical. Half of the population have been displaced. We still have about 6.5 million refugees outside of Syria. And there is still war going on. And of course, chemical weapons were used. There were attacks on healthcare facilities. More than 580 hospitals were bombed. In spite of that, the attention was very, very mediocre. One time, Richard Stearns, who is the president of World Vision, wrote this article in 2015, "Why Syria Needs an Earthquake." And he mentioned that in 5 years, at that time, Syria crisis was going for 5 years, his organization received less donation about Syria than 1 week after the Haiti earthquake. So he mentioned that some of the reasons for that, the less attention to the Syrian crisis, in spite of the scale of the crisis, is the 3 M's. One M stands for man-made. People in general tend to focus less on man-made disasters compared to natural disasters, although we're not seeing that here with Ukraine. So probably this is not right. The second one is mind-boggling, because there are many countries that are interfering in Syria. So geopolitics, I think in general, we are in the United States of America, don't know much about geography and history. I hope that I'm not offending anyone, but this is my observation. So in order to know what's going on in Syria, you need to know, for example, the history, the geography, the role of Turkey, the role of Israel, the role of Saudi Arabia, the role of the United States and Europe and ISIS and all of these things. So makes things very complicated. So there is no clear villain and black and white here. There is a lot of actors who are interfering. Of course, that's if you want to make it very complicated. To me, it's very simple. We'll talk about how it started, but mind-boggling makes people pay less attention. And the third M, according to Richard Stern, is Muslims, because many of the victims in Syria are Muslims, and post 9/11 we tend to have negative association between Muslims and things. So that's makes us less sympathetic to Muslims. This is according to Richard's turn, but of course there's many other factors. I think the media play a major factor. If you go at CNN and Fox News and all of the news outlet, they're airing nonstop about what's going on in Ukraine. And I think every person who can be interviewed, Ukraine has been interviewed. In Syria, we rarely had media coverage on what's going on, and that, of course, affects the public and affects policy makers. This is one article that I published in 2015 about shouldn't we care more about Syria, and I mentioned why is it important to care about these crises that happens in distant land, because at one point it will come back to haunt us. Besides, of course, the humanitarian crisis and the refugee crisis, use of chemical weapons, the red line that was set by President Obama about not using chemical weapons was crossed by Assad and Russia more than 300 times. And because of that, and because that we let it happen and there were no accountability, we're talking about chemical weapon use right now in Ukraine. When you don't have accountability, then the bully will continue to do things that they do, including attacks on healthcare centers. In Syria, more than 580 hospitals were bombed, and we're seeing the same thing right now in Ukraine. So we should care about these crises, of course, as humanitarian, as physicians, because it's the right thing to do. Morally, it's the right thing to do. But also, if we don't do it, then it will come back to haunt us. This, of course, number of Syrian refugees. 1 out of 4 refugees in the world right now is from Syria after 11 years from crisis. So we have about 25 million refugees. 6.5 million of them is from Syria. Up to now, there is 4.1 million Ukrainian refugees within 4 weeks of the crisis. I frankly expect that if this pace of war continued, that we will end up having at least 10 to 15 million refugees. Brace for a lot of refugees, and I think and that also will affect the humanitarian system in general. There's not much resources to provide for countries that are absorbing these refugees. So it's important to stop the war as early as possible and stop the flow of refugees. This is one of the refugee camps in Bangladesh, in Cox's Bazar. In one of our missions, I took these pictures, and this is one of the largest refugee camps in the world in Cox's Bazar. And this is, of course, because of the Rohingya crisis, which was recently labeled as genocide by our government. So more than 1 million Rohingya refugees were pushed out from Myanmar and ended up in the eastern Bangladesh area. This is, of course, the number of refugees by origin, and this is before the Ukrainian refugees, an older slide. Syria, before the crisis, was a middle-income country with reasonable healthcare benchmarks. In spite of the low government spending on healthcare, the life expectancy was 76 years. A lot of smoking, highest smoking rates in the world, probably. And like any other countries that made the transition from communicable diseases to non-communicable diseases, many people suffered from NCDs, hypertension, diabetes, heart disease, COPD, asthma, chronic kidney disease, and that was killing most of the population in 2011. It started with the Arab Spring, with people asking for freedom and democratic reform. The regime, of course, there's a complex geopolitical scene. Everything from neighboring countries to distant countries interfered in Syria. Of course, global warming also has an impact, where you have a drought, unprecedented drought in Syria that led to displacement of population to urban areas. A lot of young people who had no jobs, and that created pressure on the government, and the government was not able to respond to that. So all of these factors created the perfect storm for the crisis in Syria. And of course, the main reason is the response of the Assad regime to the demonstrations. He used snipers, he used siege, he used the army to kill people, the industrial torture. More than 114,000 people disappeared in the prisons in Syria. We have documentation of pictures and names of at least 15,000, and these are in the Caesar file. But the brutality of the Assad regime led to people carrying arms, and of course, other countries intervened. That led to civil war that created this refugee crisis, of course, chaos and ISIS. These are some of the pictures from Syria, where you have large refugee crisis. Of course, you have, these are the some of the pictures from the Caesar file of people who were tortured to death. We haven't seen things like that since the Holocaust, and the number that we're talking about is 114,000, according to UN Human Rights Council, and this is a huge number in a small country. Some of the numbers from Syria, which I've mentioned, average life expectancy dropped to 69 from 76, similar to life expectancy 29 years before the crisis. So that's the impact of war, not only because you have a lot of young people who are being killed, but also because of the impact on public health system that will be disintegrated when you have a war. So people who have diabetes will suffer, people who have hypertension will suffer, every person who have chronic disease will suffer, pregnant women will suffer, many of them will end up with C-section instead of normal delivery, no prenatal care, and these are things that you expect in war. This is one of the articles that I co-wrote about the impact of the war in Syria. It's a good reference if you have time to read. War is the enemy of health, and it's focusing on pulmonary critical care and sleep medicine and impact of the crisis in Syria. These are the pictures of children who died because of sarin gas use that was used in Ghouta area around Damascus in August 23rd, 2013, clearly crossing the line that President Obama has put, but in spite of that, there was no accountability. More than 1,300 civilians were killed with the use of sarin gas at that time. And then the Assad regime continued to use different types of chemical weapons more than 300 times. One of the physicians in Aleppo told me at one of the medical missions, thank you for sending all of the medical supplies, but we send us coffins or body bags. We ran out of them. And the same thing I've heard actually in Ukraine 3 weeks ago, that physicians wanted body bags because they are running out of them. Civilians' share of wars, as you see in Syria, it goes up with time. And as we are seeing right now, the Russians bombing and putting cities like Mariupol under siege, the share of civilian death and the death related to war will increase, especially women and children. These are the percentage of women and children who are victims of different type of warfare, whether it's explosive or chemical weapon or siege or shooting or detention in Syria. And this is one of the victims, which I took care of in my last medical mission to Aleppo in 2016. Ahmad, he's also a victim of barrel bomb. He has a chest tube. And this hospital was built underground because it was bombed multiple times. So it's called M10 underground. And they have actually good tools and equipment that was provided to them across the border. And Ahmad had a chest tube, and he was in severe respiratory distress when I saw him in the ICU. And I asked the physician to intubate him. Physicians are well trained. So the concept of risk reduction is very important during disaster, which is basically how do you minimize casualties and morbidity and mortality in the war. And some of the things that we do, whether it's sending medical supplies or medical equipment or training physicians on using these medical supplies, are very important. It will save a lot of lives within the population, and it gives also the support to the local healthcare workers that they will need. One of the many things that I've heard many times in the countries that are going through disasters, that the fact that you are with us and standing with us is the most important thing. So paying attention to what they say, paying attention to what they need, and trying to help them means the world for these doctors and nurses. Healthcare workers are under attack in many areas of the war. We've seen that in Ukraine, of course, more than 20 hospitals, according to the WHO, have been bombed. In Syria, more than 580 hospitals were bombed. More than 930 healthcare workers were killed, mostly by the Assad regime and Russia. This is one of the largest medical centers in Syria, in Aleppo, northern Aleppo, and this is the same center after was bombed frequently. These attacks are systematic and again documented by many human rights organizations, by the UN. In spite of that, there is no accountability. These are some of the numbers that were documented by Physicians for Human Rights on attacks on healthcare in Syria. And this is some of the activism that we have done in New York. This is DIN in front of the United Nations and each number of those represents one of the healthcare workers in Syria that was killed. Of course, targeting a hospital is a war crime. The communities were put under siege, similar to what we are seeing right now in Ukraine, where you have cities are under siege, and of course the civilians will suffer. Of course, suffering could be that the patient will not have access to surgery, or patients will not have access to medications, or patients will not have access to medicine whatsoever. And of course, children will not have access to baby milk, and this is one of them. And this child in Zabadani in Syria, which was under keys, had severe malnutrition. And her mom was saying that I'm feeding her water and salt because she did not have milk to feed her daughter. Chemical weapons is not something that we learn in medical school. It was used frequently in Syria more than 300 times. This is an instance of use of mustard gas, but sarin gas, which is a nerve gas, was used also multiple times. And of course, chlorine gas was used many times. Chlorine gas is a shocking agent. I saw some of the victims of these chemical weapon attacks. Did not kill many people, but it scares the population. Less than 1% of the people who were killed in Syria died because of chemical weapons, but it caused a huge displacement of the population because of the fear. Of course, it's also a barbaric way to kill people and kill civilians. Of course, chemical weapons are heavier than air, and when population try to flee bombing, they go to the basements or bomb shelters, and chemical weapons are seep in these areas because they're heavier than air and kills those people who are trying to hide from the bombing. A lot of documentation, of course, about when and the details of the use of chemical weapons, and was documented by the United Nations Joint Investigation Mission. It was documented by the OPCW, which is the organization that is responsible for prohibition of chemical weapons, and until now, there's no accountability. So with war, you have influx of trauma cases, disability due to war injuries, shortage of medical supplies and human resources, flight of healthcare professionals, epidemics of infectious diseases. We've seen tuberculosis, we've seen polio in Syria after it was extinct, we've seen leishmaniasis, and of course, COVID was not in the local healthcare system was not able to adapt to the COVID pandemic. Malnutrition in areas under siege, you have an epidemic of NCDs because people don't have access to medications for NCDs. Mental health crisis, everyone you see in war areas, it's traumatized, drop in life expectancy, deterioration of women's health, and disintegration of the public health systems. And this is the life expectancy in Syria and how it dropped because of the crisis, because of the war. I mentioned the polio epidemic that happened in 2012 because the population did not have access to polio vaccine. Of course, people wanted just to pay attention. I'm going to end this long presentation. My wife always tells me that you have too many slides with some of the bright spots and the how people reacted to the crisis. So some of the things that was done by NGOs, including my organization, is sending medical supplies across the border, sometimes through smugglers and sometimes organized by the United Nations. But you have to get the medicine and the medical supplies that will save life to people. And this is one of the first responsibilities of humanitarians. And so be generous if you would like to donate to people who are going through disasters, whether they are in Ukraine, or other places. So cross-border relief. Of course, learning and teaching the principles of dealing with limited resources, from preparing to substituting to adaptation, conserving, reusing, and reallocation. This is very important principles that we don't learn in medical school, and we have to learn during crisis. And people of Syria have shown a lot of creativity in how to deal with that. Many other, of course, disaster area using technology and telemedicine we used in Syria to reach areas that are difficult to use. And there are right now many technologicals and applications that you can use on your iPhone or smartphone, where you can see patients in different areas that are difficult to access and interact with the physicians who are taking care of them. So using telemedicine is one of the way to reach areas and provide access to healthcare to the specialists and also to the patients. Using portable ultrasound, this is something, POCUS, point of care ultrasound, something that we have done in Syria, we're doing right now in Ukraine. Actually, this Monday, we have a team that is going to Lviv, Ukraine, to provide training on portable ultrasound with using butterfly probe to Ukrainian doctors. And this is something that can be done in the field, can be done to diagnose bleeding and, of course, assess patients with polytrauma, and that will affect the management. Many times, you don't have access to CT scans or MRIs or what we have in our trauma centers. So portable ultrasounds is one of the way to democratize medicine and to improve access and reduce risk in disaster areas. We've done a lot of training on IOs, intraosseous needles, and many other trainings on mass casualties, disaster management, chemical weapon response in Syria, and we're trying to do the same thing in Ukraine. This team that is leaving on Monday will provide, besides POCUS, portable ultrasound training also on disaster management, on chemical weapon attacks and mass casualties. In Syria, they did not have electricity, so this is one of the lectures given by one of the physicians here in Chicago, and they were using car batteries instead of the electricity to listen to the lectures. These are medical students in Al-Ghouta near Damascus, and because of the bombing of hospitals were built underground. That, of course, did not prevent bombing with bunker busters, but reduced the casualties and reduced impact on patients and physicians. This is Dr. Al-A'raj, Hassan Al-A'raj. He's a cardiologist in Hama, and I met with him in 2016 in his hospital. It looks like any other hospital here in the US with monitors. This patient had SVT, and he was explaining to me what's happening with the patient, but this is the hospital from inside. This is the central cave hospital in Syria. It was built inside a cave. Mashfa al-Maghara al-Markazi in Arabic, for those who speak Arabic. And this is the outside of the hospital. Unfortunately, this hospital was also bombed, and Dr. Al-A'raj was killed while he was leaving the hospital by a Russian missile, allegedly. And he wanted to convert this hospital to a museum after the war, but unfortunately, he did not have the life to do that. Refugee crisis, of course, that follow any war. We're talking about 4.1 million refugees in the first 4 weeks of war here in Ukraine. We had a huge refugee crisis in Syria. Many of the refugees in Syria are traumatized and they have PTSD and anxiety and depression. Of course, many of them, of course, have NCDs, non-communicable diseases. Germany, compared to the US, embraced Syrian refugees. More than half of them are now in work and pay tax. About more than 500,000 of Syrian refugees were accepted to Germany, compared to 29,000 only in the United States, including the Biden administration, by the way, that wanted the pledge to change the attitude towards Syrian refugees, but until now it accepted less than what the Trump administration accepted in terms of the Syrian refugees. I think this is too much information. My wife is always right. These are some of the pictures in the refugee camps in Greece. This is inside the tent. People are very hospitable in spite of what they went through. If you enter to a refugee camp, please make a habit to enter a tent and sip the tea that is provided to you. People are very generous. This is one of our teams that went to Greece to provide help to the refugees. These are doctors who came from all parts of the world to participate in helping the Syrian refugees, young and old, me and my son, and 3 physicians from the UK. These are our team in Bangladesh to help the Rohingya refugees. We have now 5 clinics in Bangladesh. And this is some of our work in Puerto Rico following Hurricane Maria, in Lebanon, in Palestine, Gaza, in Sierra Leone, in Yemen. This is Dr. Alex from Philadelphia, who's explaining portable ultrasound to the Yemeni physicians. And this is in Colombia with the Venezuelan refugees. Thank you very much.
Well, thank you for that fantastic presentation, very illuminating for us. We have a couple questions in the Q&A box. I'll be reading them to you. And if anybody has a question now, please put it in the Q&A box, not the chat box, the Q&A box, and I will address them to Dr. Salul. First, I'm going to start off with a question I have myself. Were any of the lessons learned from the Syria experience applied to the Ukrainian experience? Was anything learned, or is everyone making the same mistakes, or what's your opinion on that?
I think we can look at this, but this is a very important question. So I think the first thing that we learned that policymakers and countries do not learn from crises like what happened in Syria, because if we responded the right way and stopped the war earlier and prevented what happened in Syria in terms of the refugee crisis, we would not have ended up in Ukraine. So some of the things are not learned. But at the same time, right now, I'm seeing more emphasis, for example, on preparing the Ukrainian healthcare providers on chemical weapons. We did not have that in Syria. So after it was used multiple times, we had to struggle to provide that training and antidotes and all of these things. So there is a lot of now preparation and talk and so forth on red lines on chemical weapons in Ukraine. The same thing with the threat of bombing hospitals. It's out there in the media. So this kind of process of shaming the Russians may help, although I don't believe that the Russian army can be shamed. But so these are, of course, the influx of humanitarian aid to the Ukrainians is something that we have not seen in Syria in that amount. And the embracing of the refugees by the countries around Ukraine is something that we have not seen in Syria. So I would say that our response, international community response to the Ukrainian crisis so far has been much better than that in Syria.
Mm-hmm. Questions from the box here, the chat, the Q&A section. You keep mentioning about the war in Syria and Ukraine, and you mentioned the geopolitical situations. Who is responsible? I think this is a broader who, responsible for the war in Syria and the war in Ukraine. Who do you blame?
I mean, wars are complicated, of course. I'm not a military analyst. I'm not international foreign policy analyst. But I mean, I know Syria because I grew there, and I know people blame all kinds of countries, but I blame the government because if they did not respond with this extreme brutality to the demonstrations who wanted freedom and democratic reform, we would not have ended up here. Yes, other countries have interfered, and always when you have divisions within a country, you will have influx of guns, and of course, gun makers, the military-industrial complex always benefit from these wars. That, of course, is a huge factor. But in Syria, I would blame the government. And in Ukraine, I think this is very clear, black and white to me, that Russians are to be blamed. I spoke with many Ukrainians who think the same thing. I mean, there's no excuse for Russia to invade another sovereign country.
Peter Ulrich has a very relevant question here. How do you train local workers, students, et cetera, in an accelerated timeline when dealing with emergencies or crises like the situation in Syria or Ukraine? And I think if I could add on to that, what can we do even here? Is there something, I mean, yes, we can send people over there, but should we be taking some Ukrainian students, residents, younger faculty or whatever, bring them, training them in trauma or something like that and sending them back? I mean, what do you think? What can we do?
In my hospital, Christ Advocate, at the beginning of the pandemic, COVID pandemic, we used simulators and scenarios to train our physicians on COVID management. And we trained in 1 week more than 100 physicians. Every day we had trainings, including simulators and scenarios and so forth. So we can do training in the US and other places at accelerated pace. And people, usually learn these skills quickly, especially when there's a crisis. And you can provide this training. The best thing, of course, to provide the training inside the country if you're able to do that. So that's why we're going into Lviv. You can provide it using online training. So some of what we're doing is providing online training and having videos available in Ukrainian to Ukrainian healthcare workers. So this is a huge thing that if Northwestern can do that, that would be helpful. And of course, if you can bring Ukrainian physicians to be trained on certain things and then going back, that would be great. But this is very complex, of course. And Ukrainian physicians are not able to leave right now because of the huge need inside the country.
All right. From Hrer Atarian, he says, in addition to all the healthcare problems wars directly cause, there's also pervasive discrimination against refugees in host countries, and that's a huge problem for chronic health. Any comment on how to deal with that?
I mean, I had one whole lecture about refugees and how Syrian refugees and other, of course, refugees are treated in countries that are hosting them. By the way, most of the countries that host host refugees in general are less developed countries. That means they do not have enough resources to provide the same health care and education and shelter and jobs to the refugee communities that they host, whether it's Bangladesh for the Rohingya refugees, or Sudan for the Ethiopian refugees, or Jordan and Lebanon and Iraq for the Syrian refugees. These are countries that they have their own problems. So without humanitarian assistance from the West, their communities will suffer and the refugees will suffer more. So the Syrians are treated as a second or third class citizens in Lebanon, in Jordan, in Iraq. There's a lot of hostility right now against them in Turkey. The same thing with the Rohingya refugees in Bangladesh and other refugees. And this is a huge problem because we are having now more refugees than any time in our lifetime. And that is increasing because of the global warming, because of the displacement of the population and limited resources and water shortage. So we have to find different solutions for this problem. Otherwise, we're going to have a huge issues that every country will be dealing with.
All right. And Sarah Clark asks, what are the best ways that a U.S. citizen living here can support refugees? Is there organizations to donate, volunteer? What exactly can your audience here do in this situation?
I mean, that's a great question. And I think paying attention is very important. There are many refugee organizations in Chicago. Chicago is one of the most welcoming cities for refugees. If you just go to the north side, you're going to see every language. One of the schools that I visited, I think Sullivan High School, has 140 different languages because most of the refugees. So you don't have to go a long way to see refugees. My wife has an organization called the Syrian Community Network. She founded it, and it's providing support to the Syrian refugees, Afghani refugees, and now maybe in the future the Ukrainian refugees. Yeah, donation to these organizations, volunteering with them to mentor refugees would be very helpful. And if you want to provide the healthcare to the refugees in distant land, you can volunteer with MedGlobal. We provide refugee health to the Venezuelan refugees in Colombia, to the Syrian refugees in Lebanon, to the Ethiopian refugees in Sudan. There are many other organizations like ours that do the same.
Yeah, thank you. People are trying to help. They just don't know which way to turn. It's so awful. Well, anyway, that's the end of our questions that we have gathered today. And so we'll bring this to a conclusion. I want to thank you very much for taking the time to share your insight and expertise with us today. I want to thank the audience for joining us and for submitting your questions. When we invite you to join us for the next installment of the Institute's seminar series, remember this is the first Friday of every month. It's going to continue on Friday, April 6th. And for those that have registered, a recording of this webinar will be shared via email shortly. So you're feel free to share it. And with that, this concludes today's webinar. And I hope everyone has a great afternoon. And thank you again, Dr. Salou, for joining us today. We really appreciate it. And welcome back.
Thank you. Thank you for everyone.